Well, hello, everyone. Today we have Dr. Aleksey Prok from Lima Memorial Hospital Spine Neurosurgery and Pain Management here to talk a little bit more about his specialty of pain management. So thank you so much for joining us today, Doctor.
Good morning.
All right, so can you give us an overview of your specialty of pain management and kind of what role it plays in healthcare?
Well, today it seems like pain management is the biggest problem because more and more people have chronic conditions that cannot be really cured, but hopefully they can be manageable. So the spending on a pain management of different sorts is astronomical, and it seems like they produce more and more physicians every year, and still is a shortage in this country.
Right. Now, well, what kind of conditions or illnesses do you normally treat?
Well, I'd say there's a million conditions. Really, any painful condition could be referred to us. I would say most frequently that we see is low back, middle back, neck pain, arthritis of different sorts, cancer, people who had injuries and continues to have pain, though it seems like bones have healed, etc.
Right, so lots of variables there. So what treatment options might patients receive in your office?
Well, classically it's a 4 Ps, physical, psychological, pharmacological, and procedural. So in this office, I do procedures and pharmacology, which is medication. Physical would be something like chiropractic, physical therapy, massage, acupuncture, etc. So we obviously refer out. And psychological is a huge problem because by what I read, about 75–80% of population in pain management are people who have psychological and psychiatric condition, because we think chronic pain happens because the brain frequently does not process information correctly.
That's interesting. Now, how do you actually involve your patients in their care? How does that come about?
I found, unfortunately, majority of my patients not to be very educated in their problem. And as soon as I start showing the pictures and I have models and etc., they become very interested. And then the most frequent compliment I heard is that nobody ever talked to them like this and no explaining to them. And after that, after they have some understanding, that's when they become interested, because before they just simply don't know what to ask.
That's true. And, you know, knowledge is power. So, you know, the more they know, the better. So now if somebody would actually want to make an appointment with you, now, can they just call your office?
Yes, they can call my office. We are extremely efficient. If you have a cancer pain, we will see you within 48 hours, but generally within 1 week, you will be seen.
All right. Well, Dr. Aleksey Prok, thank you so much for joining us today. I appreciate it.
You're welcome. Very nice chatting with you.
Well, don't go away because we have more to return.